message because this is my personal computer and record it. Maybe, I don't know, use it in the association to promote our conference. Okay, so as you can see, the updated title is Medicine and Healing in selected Old Norse sagas. So how did everything start? Well, I started my research from an episode that I knew from the saga of Saint Olaf, where it is mentioned that Viking soldiers with abdominal injuries were administered strong onion soup, and if the onion smell could be felt through the wound, this was interpreted as a sign that the wound was very deep and that the patient was unrecoverable. So I saw this as a social media post on Facebook by a former student. And when I saw this post, that you can see the picture here, I became intrigued and did a little bit of research to see, what was this anecdote about. Boastingly, as I was on Facebook, I explained to that former student that the post refers to the episode in the saga of Saint Olaf, and that the warrior which is mentioned, the warriors which are mentioned in the post, in the picture, knew about the purpose of the onion, and in the episode refused it, instead asking for the extraction of the arrowhead, which proved to be fatal. And then the Viking warrior said the famous last words, praising the king, that he paid his soldiers so well that they had fat around their hearts, and then the warrior passed away. So actually, it was not about bravery. It was more about, like a praise of kingship. And the episode is in this fragment here, called The Death of Tormod, chapter 234 from the saga of Saint Olaf, which is found in Heimskringla. And you can see the fragment here, the primary source. Now I wanted to discuss some context of this. So we can see that Tormod did not accept the soup given by the healer, and after he asks her to extract the arrowhead, he says, well, has the king nourished us? There is still fat around my heartstrings. And after that, he passed away, and thus his story ended. Now, I wanted to clarify some aspects regarding, medicinal knowledge in medieval Scandinavia. Now, medical knowledge and magical thinking went hand in hand, but not in the case of this example from the saga, which does not mention anything magical. And we know, for example, from archaeological excavation in Iceland, in which the remains date from 1000 to 1200 AD, where they discovered remains with good bone and teeth health. And even though, there is this aspect, there are some things worth taking into consideration, namely that these communities were very sparse. They were spread over large areas, so sometimes it was, but they were also very secluded. So whenever there was some kind of infectious disease, they were affected by it. It's important to note that the healer mentioned in that chapter, which I mentioned, the death of Tormod, is a woman, okay, and she is called Leknir, which means medical practitioner in Old Norse, and is derived from the Old Norse word lekna. Lake played an important role in Norse society as they were responsible for providing medical treatment to the sick and injured. They were skilled in using various medicinal herbs as well as surgical procedures, amputations, and even trepanations. And we can see this example from trepanation, which is exemplified in the study that I mentioned here. And you can see that based on the round edges of the trepanation hole and the fact that there is this healing tissue, this is the only example of a successful trepanation from medieval Norway, from medieval Scandinavia. So there must have been a very skilled surgeon in 13th century Trondheim where this skeleton was found. Okay, so without a doubt, it requires a high level of skill to perform successful surgery like this, drilling a hole, opening the scalp without damaging the meninges and preventing infection and sepsis. But the identity of this surgeon who performed this operation remains a mystery. Now, the Leiknir, the healers, also had a spiritual dimension to their practice. They often combined their medical knowledge with shamanic practices and divination, and they were believed to have the ability to communicate with the gods and spirit and could use this connection to diagnose and treat illnesses. But in the example, the healer uses a physical property, namely the smell of the onion soup, to identify any damage to the intestines or to the stomach of the patient. So it's not the case. I have left out magic and health because that is a very common motif in some sagas, and it would have mean too much. I have tried to stick only to these examples where a medicine is practiced in a non-magical way. We must also keep in mind some conditions of medieval Scandinavia. Good health has certain limits. The findings of archaeologists indicate that housing conditions were of low quality, hygiene was not a priority, there was a high prevalence of unsanitary living condition, and this meant high infection rates, particularly among children, which significantly impacted both morbidity and mortality rates. And it's important to consider that health and medicine in the Nordic countries in the Middle Ages were impacted by the fact that the inhabitants lived, as I mentioned earlier, in small settlements or farms scattered over a vast area. There were few cities and the distances were significant, which made communication challenging, especially in northern regions. Infections were common, and while living in separate settlements provided protection against epidemics, it left the population vulnerable to imported diseases. The inhabitants' subsistence minimum made them more susceptible to infections, malnutrition, and famine due to short-term and long-term climatic fluctuations as well. Deficiency diseases were frequent, especially during the winter season, and many of the Old Norse suffered from multiple diseases, making it difficult to evaluate the historical health conditions. It's also interesting to note that we have legislative sources like the laws of Västergötland and Östergötland and the Frostating law, which mention that payment to those injured was calculated according to the severity of the wound. And the Frostating law reads that a bone payment is payable wherever a bone comes loose from a wound, though it be very small, as long as it rattles when shaken in the shield. Then 1 aerir must be forthcoming. 1 aerir is to be paid for each bone up to 6, but if so big a bone is removed from that 6 holes can be bored in it, then 6 aurar are to be paid. But bone payment is never bigger than 6 aurar. So that was the upper limit. So from 1 aerir to 6 aurar, 6 gold coins. But if a wound needs cauterizing, then the lip twisting aerir is payable. and the same is payable every time cauterizing is necessary. But as physician's fee, 1 arir is to be paid every month, and 2 months worth of flour and 2 of butter. So victims of wound injuries were compensated 1 arir to pay to the physician, to the doctor every month, and then they were also compensated 2 months worth of flour and butter, so they could, continue living in conditions where they couldn't work. And they were also compensated one arir themselves. So it's very interesting that this is mentioned in the laws as well. There's also an example in the saga of Magnus, of King Magnus, the Godi, the priest. It describes how during the battle at Lirskov in 1043, King Magnus lacked sufficient surgeons and personally chose men with soft hands to dress the wounds of their fellow soldiers. And many of these men later became known as medical practitioners, as doctors. And we have the paragraph here. After the battle, King Magnus had his men's wounds bandaged, though there were not as many doctors in the army as were now required. So the king went up to such men as seemed suitable to him and felt their hands, and as he took hold of their palms and stroked them, he nominated 12 men who it seemed must have the softest hands, saying that they were to bandage the men's wounds, though none of them had ever bandaged wounds before. And they became very good doctors. There were 2 Icelandic men among them. One was Thorkel Geirarsson of Lingnar, and the other Bard Svarti, Selardar's father Atli, and many doctors were descended from them afterwards. And there is also a mention of, just a moment. Yeah, this is better. There's also a mention of Raven Sveinbjarnarson, an Icelander who died in 1213. Only the date of his death is known, but he was renowned as a surgeon and likely had some knowledge of contemporary Salernitan medicine. So he had studied at Salerno. He traveled widely. He went on pilgrimages to England, Rome, Santiago de Compostela, France, and Italy. And it's believed that in Italy, at Salerno, he studied medicine, because Salerno was the greatest European center for studying medicine at the time, owing to the confluence of Arabic and Greek culture there, where ancient manuscripts of medicine were put into good use, and basically it was the greatest medical school of the time. Otherwise, in Scandinavia, we don't have medical upper education in medicine not until 1477 at Uppsala and 1479 at Copenhagen, with the establishment of the universities. Raven was very well known for his hospitality and generosity, the fact that he didn't charge any money for his services, and people came to his estate and stayed with him until they got better, and he was, they made pilgrimages to Raven in Iceland so he could heal them. But he is known for his conflict with his arch-rival Thorvald Stonarsson, who eventually kills him in a duel. So we know this from the saga. The women who practice war surgery are mentioned in several instances. For example, in Njal Saga, chapter 34, there is Hildigun, who is described treating her father and siblings, and then in Hardar Saga, in chapter 25, Helga is called Godur Leiknir, a good healer, and in Droplaugar Saga, the saga of the sons of Droplaugar, another female doctor is mentioned. The saga is about two famous brothers. After they were killed in battle, their aunt Groa suspected that their brother Grim, who was severely wounded, might still be alive. She went to find Alfgerd, a doctor, to attend to Grim's wounds. Alfgerd secretly took Grim away after tending his wounds to prevent news of his survival reaching his enemies. Grim recovered from his wounds and later returned to avenge his brother's death. However, Grim died from a wound on his foot, which was tended by another woman healer, who claimed to be a doctor, but was actually described later as a witch. She was skilled in magic, and that she was actually a concubine of one of the enemies of Grim, okay, an evil, so-called an evil Viking. Also, in Eyrbyggja saga, mentions the healer Snorri Godi, Snorri the priest, and we have this excerpt there. There are actually very extensive descriptions of people going to Snorri and getting healed, but this is one of the best descriptions. And they always mention that Snorri's assistants are incompetent. They fail to straighten, people's broken bones, and they fail to prescribe the correct treatment. But Snorri always realizes and establishes the correct diagnosis and heals everyone who comes to him. And we even have this example here where he straightens the head of a warrior, okay. And so in conclusion, Snorri appears as a kind healer, as a skilled one. His intelligence is praised. What can archaeological evidence tell us to confirm this? Well, indeed, medieval burial sites indicate that advanced surgical procedures were occasionally performed during that time. We have instruments from the Middle Ages, bloodletting equipment, needles, forceps, catheters have been found and preserved. And there were documented surgical interventions for gallstones, cleft palates, trepanations, as we have seen. But the progress of surgical practices in medieval Scandinavia was deterred by the opposition of the Christian church later, which forbade surgery and the many medical practices that were actually based on reason and not on the ancient theory of the four humors. Now, as a conclusion, by studying these sources as well as archaeological findings, we can see that various medicinal treatments were used, including herbs and drugs borrowed from classical Greek and Roman medicine. These remedies were blended with local herbal knowledge, and certain plants and vegetables were consumed both for their flavor and for their preventative and curative qualities. The herb von or angelica was particularly esteemed, but I want to leave herbs as medicines for a different paper, because there is a lot on this as well in the sagas. Medical and herbal books from ancient Scandinavia were usually derived from manuscripts originating from Central Europe. Henrik Harpenstreng is an often mentioned author. He is from Roskilde in Denmark. As regards the existence of hospitals, large hospitals were not established until well into the modern age, but small hospitals existed alongside churches and monasteries, like the hospital in Trondheim, which treated that trepanation that I've shown you. Unfortunately, as I said earlier, we do not know who that that skilled surgeon was, but only that the hospital existed roughly from circa 1170, 1180 AD. So the history of early hospital is not very clear. Sources and definitions are imprecise, but it's safe to say that during the Middle Ages, monasteries in Scandinavia played a crucial role in caring for patients such as leprosy patients. You know, leprosy was a widespread condition, and hospitals were founded throughout the region to treat the disease. So thank you very much for your attention.